Hello and thank you. My name is Lori Kirkendall. Thank you for the opportunity to bring you information on the progress of House Bill 1525, Section 7, related to SHAC, School Health Advisory Councils and Sex Education, about which I'm sure you have all heard ongoing debate in your districts at the state level and across the nation. I hold a degree in health education from A&M and a master's degree in public health. I serve as president of Beacon Health Education Resources and have worked with sex education in Texas schools since 1995. I worked with TEA and the state board on the new health TEKS in 2020 and curriculum adoption in 2021, and then worked with legislators on the bills I'm discussing with you. Currently, I train SHACs and work with school administrators across the state. With the passing of HB 1525 last June, followed by Senate Bill 9 in September, major changes came to the laws related to sex education in Texas. The timing of these bills was critical as they followed the adoption of new health TEKS. The state board had worked for 2 years revising the health standards, which include reproductive and sexual health, beginning in 4th grade. Those new standards go into effect this coming school year. The passing of new standards for the first time in 20 years meant that all school districts would need to evaluate their current health curriculum and most likely select new curriculum to meet the expanded TEKS. HB 1525 strengthened the legal requirements for how health curriculum is to be reviewed and adopted at the local level. The language there increased transparency, accountability, and most importantly, local parent and community involvement. What it didn't increase was monitoring and enforceability. Curriculum for health and sex education is voted on by local boards with the guidance of their SHACs. HB 1525 gives very specific instructions for how SHACs are to operate, similar to open meetings, and specifies how proposed curriculum is to be made available for public review and input. A second major change that came in HB 1525 is that all sex education became what we call opt-in, where written parent permission is now required for all students to participate. Previously, the law had been an opt-out law. Senate Bill 9 came behind in the second special session and added 4 sensitive topics to all of these regulations: child abuse, family violence, dating violence, and sex trafficking. One general statement I will make to summarize this report is simply that schools have been overwhelmed with all of these changes: the new health TEKS, House Bill 1525, and Senate Bill 9. As I testified to this committee last spring, across the 1,200 school districts, SHACs look very different. Many districts didn't have a working SHAC, or their membership didn't meet the legal requirements, and many didn't operate with transparency and accountability. These 3 new sets of changes brought attention and sent many districts to work to come into compliance, but we have a long ways to go. Unfortunately, guidance from TEA was limited and came late in the year. On the handout I gave you, you'll see the first page of 2 FAQ documents that they published just in April. Guidance from TASB was also limited and confusing. I gave you 2 of those 2 pages as well. The new law requires schools to publicize meetings and to post detailed minutes and recordings. Of the 6 big urban districts, only 3 have done that successfully. The new law details specific steps for adopting curriculum, and I have heard complaints from parents across the state. I'm guessing you probably have too. A major concern I've seen is that the new SHAC regulations and opt-in requirement have taken attention away from the existing sex education laws. In the packet I provided with the amended Texas Education Code 28004, you'll see those areas highlighted in yellow with the new changes in different colors there as well. There are 2 big areas where schools are continuing to violate the law: in required makeup of the SHAC and in adherence to the 5 tenets of sexuality instruction with centralized abstinence from sexual activity. SHACs are to be made up of a majority of parents of district students not employed by the district. A parent is to chair or co-chair the SHAC. This simply is not the case in many districts. I noticed in one large district, only 2 of the 19 attending were parents. New curriculum must do 2 things: meet the TEKS and legally comply with all 5 tenets of Section E. The state board adopted 1 health curriculum for middle and high school, which schools can choose or they can make their own local selection. Many are considering curricula that violate either of these 2 things. Either they don't meet the TEKS or they violate the education code. Some districts have recommended McGraw-Hill, a curriculum that is not compliant with Texas law. Other curricula that violate this section of the law include Big Decisions, Health Smart, and Get Real. I would ask this committee to consider ways to provide more direction and support for schools for implementing all of these changes and upholding the law. More importantly, we need to look at ways to monitor and add enforceability to these important regulations. You all were pressured to add a 3-year expiration date to the new opt-in law, and I would ask that you repeal that expiration to allow schools more time to fully implement these changes. Thank you for your consideration of these very important changes to the critical and sensitive topic of sex education. At the back of your packet, you'll find a compliance checklist that can be used in the schools that you represent and could be a helpful resource for the state. Happy to answer any questions on Section 7.
All right. Thank you, Ms. Kirkendall. Any questions for Ms. Kirkendall, members? I think Mr. Tallarico has a question.
Hi, thank you so much for being here. Thank you, Mr. Chairman. Wanted to ask you, and I know this was passed last session, but there may be conversation about it going forward, and I want to know from your area of expertise the impact of this opt-in provision. First, I want to know, is there any other part of our health TEKS that parents opt in to having their students learn? So anatomy, nutrition.
The opt-in is specific to human sexuality and then child abuse, family violence, dating violence, and sex trafficking.
Okay, and so it talks about any discussion of drug abuse and drug prevention. That's not opt-in either. It's
Correct.
Just sex.
Correct.
Okay. Do we know what the impact has been? Are districts getting, almost hopefully near unanimous consent for students to learn about maybe the most important topic that they'll learn about in school?
I'm going to say yes and no, right? There's such a diversity, I think, as I mentioned in my testimony. Every district has struggled to figure out how to bring this online from an administrative and logistics perspective. We recognize the challenge of it. And yet, as I've trained districts and administrators, it's easy to say, although it's not this simple, we know how to get parent permission. If we're going to take the children to the zoo, we get parent permission. So I think it's changing a framework around communication and increasing transparency and parent involvement that allows that to happen. But I'm first to acknowledge with the schools I work with, this is hard. This is a challenge. We've got to get to work to elevate the importance of this topic and the importance of that now required parent permission.
So yeah, it certainly sounds like a challenge. It certainly sounds like it'll decrease the amount of students receiving this instruction, this critical instruction. And do we know, at least among health educators and among experts in this area, why sexuality would be the part of the TEKS that we would make opt-in instead of opt-out?
Well, I think that there's going to be a given diversity of values around this particular sensitive subject. It is considered to be a sensitive subject. We don't have debates over the 5 food groups or the My Plate content, right? So sexuality instruction, and when the legislators saw fit in 1995 to establish SHACs, that was their intent, so that the spirit of the SHAC is to represent the local community values around human sexuality instruction, around the sensitive and personal topics of sex education. So that's what I would say is the genius of the SHAC, as it puts that down to the local level. Where there is understandably, and I think it would be, the diversity of opinion and sensitivity around this particular topic, and then to respect the parents' rights to either allow their child to participate or not would be in that partnership between the school and parent. So opt-in elevated that parent involvement piece and the parents' rights and communication piece as well. And I think it's upon the districts to represent, to the degree that they can, local community values with the guidance of the TEKS and the education code, and put forth something most parents will opt in for. But it takes a lot of communication. I was working with one district where they were referencing language challenges and communication challenges to get that written parent permission returned. I would mention, to answer your question on how's it going, several of the large districts that I've looked at have been tracking their return rate. So the form went out to 100%. They got maybe, I'm going to guess the number, 90% back, and 78% of those opted in. So they're tracking return rate and opt-in and opt-out rate. I think that's really important. But as I said, what I'm concerned about is that this was set to expire 2024, and I'm going to tell you, not every district got it in this year. We're tying in new TEKS this second year, and it's just we've got to get that expiration date extended a little bit to find out all the things you're asking.
Because even those sound like high percentages, but still it's a quarter of students not getting sex ed.
Right.
right? Which I think we'd all agree sex ed is super important for every student to get.
Sure.
And we know that we also, educators, especially in science, tackle all kinds of controversial issues. And so my concern is that maybe the theory of evolution will be opt-in, right? Because we have a large segment of the population that has a problem with theory of evolution. That's not based in scientific fact, the scientific method, right? But it is a personal belief that maybe conflicts with what we all agree should be taught in public schools. And so I'm worried about this kind of trending toward making controversial subjects opt in rather than opt out, because it's putting a pretty high barrier entry for important human knowledge that all students deserve to get. Is there any discussion about this direction that we're moving toward of putting barriers up in front of science education?
I don't know. My field is health education and sex education, so I can't speak to the science side of this.
Okay.
I understand your question and the reasoning, but I can't answer it regarded to another topic other than mine.
Okay,
Yeah.
I appreciate it. And thank you for being here.
Sure.
Thank you, Mr. Chairman.
Thank you.
All right, any further questions? I think Mr. Bell has a question, Mr. Kirkendall.
I don't have a question, but I just wanted to commend you on the information you provided us and with this checklist. I think this is really good, not only for the school districts, but for us as legislators and our constituents. So, and your answering of Representative Tallarico's questions, I thought was well done. So it is a value issue. So, and I think parents ought to have the ability to make up their own minds as they raise their kids, and a matter of how they want to get that done. So thank you.
One thing I hope to bring to the context is the 2 years of work that the State Board of Education did on the health TEKS, and then a year of work on the new curriculum, and then now, so there's this history, I think it was mentioned earlier, to kind of build on the history. And I think even to address the controversy around subjects, the work that the State Board did in 2 years of work and hearing and work groups and all of that to get the health TEKS where they are is commendable also, and should be part of this ongoing context, which is why I highlight meeting the TEKS and meeting the law. Those yellow sections in the handout I've given you have sort of gotten brushed under with some of the new TEKS requirements.
I think Dr. Gonzalez has a question or two.
I just have a question.
Sure.
I think one of the concerns is we see students across our state and country committing suicide or doing harm to themselves. We know that research and data shows us that when students have holistic information, holistic education, they're less likely to do harm to themselves. How does the SHAC have some of that data, or is the SHAC provided some of that data to make informed decisions? Because while I understand there's a values component, there is also a health epidemic of young people doing self-harm when they don't feel or don't have access to information that humanizes their experience and their reality.
I think I can address your question in terms of looking at the 617 TEKS that are there are very holistic. There are 6 strands, which include injury and violence prevention, mental health and wellness. We mentioned nutrition and physical fitness earlier, alcohol, tobacco, and other drugs. I'm not quite quoting them exactly, the 6 strands that are holistic with that complete information. So I think when we look at the TEKS that were written from all of the comprehensive information around health education to help students be successful learners and successful in life, I think you'll find a lot of the information you're looking for is in those TEKS, and then have to translate into the curriculum that is adopted by the local districts.
But what if it's not?
Can you give me an example?
I think affirming the reality of young people's gender experiences across the spectrum is critical to them feeling humanized in our school districts, and then because the ultimate consequence again is like self-harm, right? And I think we can't ignore that reality that does happen. And I guess where do we find that balance? And I'm wondering how you explore that balance.
I would refer you to the State Board of Education as they took on that exact issue around inclusivity, and where the State Board landed with the new health TEKS is on an inclusivity approach, which recognized the value and worth of every student. So every student gets the same information about suicide prevention. Every student gets the same information about dating and family violence and healthy relationships. You know, the list sort of goes on, boundaries and communication. All of that is presented to all students. In terms of specific sexual risks, it was a sexual risk avoidance approach that was upheld in the TEKS, which would be that complete information given and made available to every student, if that helps in their approach towards inclusivity for every child receiving the information as laid forth in the TEKS and the learning standards.
Okay, thank you.
Thank you.
Any further questions of Ms. Kirkendall, members? Not hearing any. Thank you all for being here. Thank you,
Thank
Mr.
you.
Trevino, and thank you,
Thank you.
Dr. King.